Thank you very much. Hello, everyone. Thank you for having me to the Finnish Psychedelic Research Association. It's nice to be here. I'm going to be talking for an hour about psychological and ethical harms in psychedelic culture and industry, taking a skeptical position towards the psychedelic movement, but also trying to be constructive and suggesting how harms might be minimized and how people could be kind of safeguarded against them. So I'll start off by talking a little bit about me. I've always been interested in the interplay between the Dionysian or the ecstatic and the Socratic or the rational, and the kind of play and conflict between these two forces in individuals and in cultures. I personally was a very Dionysian teenager. I was very into probably my most intense period of psychedelic experimentation was aged 15 to aged 18. I was very enthusiastically dabbling in psychedelic drugs and always very interested in mysticism as well. But I and several of my friends eventually had some bad psychedelic experiences. I had a bad LSD trip when I was 18, which I didn't integrate very well at all. I didn't actually talk to anyone about it for several years because I felt kind of shame around the experience. And that perhaps interplaying with other factors, perhaps interplaying with genetic factors, I don't know. But I developed post-psychedelic difficulties from the age of 18 to the age of 24, and to some extent beyond, but that was the most kind of intense stage of difficulties. The difficulties were things like social anxiety, panic attacks, dissociation, mood swings, higher neuroticism, lower self-confidence, and just this feeling of fear and confusion. What's going on with me? Is this normal and natural? If it isn't, what can I do about it? And this was in around 1996, and there was very little information about post-psychedelic difficulties or what you should do about it. And that's still to some extent the case today. Two things particularly helped me. One was a near-death experience I had when I was 24 in Norway. I was skiing, and I, went off the side of a mountain and had a kind of classic white light experience when I fell off this mountain. I've written about it. I'm not going to go into it here. And I don't make any kind of spiritual claims about that experience, purely that, first of all, I don't understand it, and secondly, it was quite healing to me. It was a kind of ecstatic epiphany. However, the epiphany passed, it faded, and the second thing that really helped me in my kind of post-psychedelic recovery was cognitive behavioral therapy and Stoicism, ancient Greek philosophy of Stoicism. So this helped me to change my habits of thinking, feeling, and behavior, particularly helped me to reduce my social anxiety, to stop having panic attacks. So the first stage of my writing career was very much devoted to Stoicism. My first book, Philosophy for Life and Other Dangerous Situations, was about the revival of Stoicism, how people use Stoic philosophy today to live more fulfilling lives. I also organized the first Stoic gatherings. The first was actually in 2010, and then there were these annual Stoicon events, which are still going. I gave hundreds of talks and wrote hundreds of articles about, how Stoicism can help you. I gave a TEDx talk about that called How Philosophy Saved My Life or something. And I taught practical Stoic philosophy in companies, in schools, in prisons, and even in Saracens Rugby Club, which is the kind of one of the leading rugby clubs in the UK. And I still very much think that Stoicism is a helpful philosophy, although it's not perfect. But by about 2013, 2014, I was seeing the limits of Stoicism, and I was more interested in the Dionysiac and how people can also be healed, not through reason and self-control, but through the ecstatic, through surrendering control, through non-rational modes of consciousness. Again, I've always been interested in the balance between the Socratic and the Dionysiac. So my second book, which came out in 2017, The Art of Losing Control, was more about the Dionysiac. I was curious, why did Western cultures become so suspicious of ecstatic experiences starting from around the 17th century? And how ecstatic experiences are returning into Western culture, particularly since the 1960s, but even more so today. I was curious, how do people find ecstatic experiences today? And when are ecstatic experiences good for us and bad for us? Clearly, they're not always good for us or for our society. They can lead to delusion, to fanaticism, to conspiracy thinking, to cultism, and so on. The main takeaway of this book, apart from looking at all the different ways that people find ecstasy, ecstatic experiences today, including psychedelics, was first of all that mainstream Western culture, particularly in Europe, I would say, has an aversion to the ecstatic, a fear of ecstatic experiences, and should be more open to them. However, a second point I made is that New Age subcultures are perhaps overly attached to ecstatic experiences, including psychedelic experiences, and have an overly optimistic or rosy or positive view of the ecstatic, that it's always good for you, it's always insightful, it's always a reliable guide to truth. And that's not always the case. So to summarize that book, we need to have a mature, balanced relationship to the ecstatic, seeing it as a natural, normal mode of consciousness, but not always a reliable or healthy mode of consciousness. How can we re-find a place for the Dionysiac or places for the Dionysiac in Western culture? The third book I co-edited was Breaking Open, Finding a Way Through Spiritual Emergency. Spiritual emergencies is a term introduced by Stanislav and Christina Grof to refer to psycho-spiritual crises, extended crises which can last weeks, months, or years. They can be prompted by meditation, psychedelics, by grief, by sudden change. And a spiritual emergency is really a kind of extended mystical psychotic trip. Now, what we asked in this book, co-edited with Tim Reed, is we asked 14 people to describe their spiritual emergencies or psycho-spiritual crises, if you prefer. We asked them to say, what do they think caused this crisis? What was it like? Tell us about the phenomenology of it. And then crucially, what helped you to deal with it? What helped you to navigate this crisis and to move on with your life? People talked about the kind of their mindset, taking the right frame to this crisis, not just seeing it as a pathological breakdown, but perhaps having the frame that this is something to work through, something that might have meaning to it, that could even be healing in the long run. Secondly, what people said they found helpful was having a good setting, particularly supportive, sympathetic friends who don't judge you and pathologize you for going through this kind of extended, messy, psycho-spiritual crisis. Thirdly, integration, finding similar stories, finding supportive literature to help you make sense of this experience, and also to reduce the feeling of isolation that people often experience. Like, am I going crazy? Who can possibly understand what I'm going through? Well, people have written about this kind of experience and talked about it. And it's very helpful when people find those kinds of similar accounts. And also sometimes people reported that a second altered state experience, often many years later, was helpful for them. That could be a second psychedelic experience or some kind of holotropic breathwork experience. But of course, there are risks to that as well. And that's not always necessarily a good idea. So now let's come to the Challenging Psychedelic Experiences project. This is a research project that I and colleagues set up 2 years ago. In 3 years ago, in 2021, at the height of the shroom boom. It's an academic research project, And the aim of it is to improve research on extended difficulties that people experience after psychedelics and what helps people to cope with or avoid those difficulties. It's a multidisciplinary, multi-researcher project. Other researchers in it include Dr. Oliver Robinson at Greenwich University, Dr. David Luke at Greenwich University, Rosalind McAlpine at UCL, Irini Argiri at Exeter University, and several other researchers. So we started it in 2022 at the height of the kind of, psychedelic hype, when there's been, this revival, this renaissance in psychedelic research led by organizations like MAPS, that's Rick Doblin at Psychedelic Science, and many other kind of research teams now around the world, all reporting on the exciting benefits of psychedelics for a range of mental health problems. There's also been this boom in investment in psychedelic companies. Billions of dollars have gone into psychedelic companies in the last 3 years. This is MindMed's stock price, though it shortly kind of collapsed afterwards. There's been sudden changes in the regulation of psychedelics. For example, in Australia, they legalized psychedelic therapy for certain conditions, psilocybin therapy and MDMA therapy, after Professor David Nutt, a leading British psychedelic researcher, told Australia's drug regulator that the harms around psychedelics have been grossly exaggerated, he said. And in fact, he said that no one has ever come out worse from a psychedelic clinical trial. So Professor Nutt said that, there's very few risks to psychedelics within safe settings, and this persuaded Australia to legalize psychedelics. So far, 2 American states have also legalized psychedelics under regulated conditions, Oregon and Colorado. And many other US states and cities are currently considering psychedelic legislation, including California this year. So there's a great deal of excitement around psychedelics, and that's in large part fed by very positive media coverage over the last kind of 15 years. I mean, just to look at Netflix documentaries, you've got How to Change Your Mind, Have a Good Trip, Fantastic Fungi, all very positive coverage, and often very little said, if anything at all, about any risks to psychedelics or any harms to psychedelics. Well, we felt that this was missing out a big, important part of the story, which is that sometimes people can experience harm from psychedelics. People can experience extended difficulties after psychedelics under all settings, including during clinical trials. And we felt that you need to learn more about those harms to help protect people from them and inform them about them. And that is the ethical thing to do. Just to kind of go back to that last slide, the consequence of this wave of psychedelic hype is a sudden dramatic rise in the number of people taking psychedelics. So, for example, the prevalence of young Americans using particularly magic mushrooms was 3% in 2018. It had doubled by 2021 to 6.6%. A few years ago, there were just 50 ketamine clinics in the US. Now there's an estimated 1,500 ketamine clinics in the US, as well as home delivery ketamine companies. In the UK, use of magic mushrooms grew 62% between 2020 and 2023. In Australia, use of magic mushrooms has doubled since 2019. So most of this is, the vast majority of this is illegal, underground psychedelic use. A lot of it is people ordering psychedelics, particularly magic mushrooms, online and taking it on their own, but also going to psychedelic retreats around the world, going to underground psychedelic guides. So it's just become very popular, and a lot of people are self-medicating with psychedelics for things like anxiety and depression. So there is a perception now in some members of the public that psychedelic risks are extremely low, that concerns about harm in the past were anti-drug propaganda, and that if you take psychedelics with care and with preparation, the benefits, the upsides are enormous, and the downsides are barely existent. Psychedelics are being presented as the next great frontier for mental health and for global spiritual and political change. They're also being presented as this bold new industry in which tens or hundreds of thousands of people expect to make a living. Coaches, guides, therapists, shamans, psychiatrists, lawyers, marketing companies, dispensaries, retreat centers, drug developers, investors, and so on. So there's hundreds of thousands of people now very financially invested in this being legalized and rolled out at scale. However, so far, most of the research that is supporting this huge movement has been produced by the industry, paid for by true believers, by philanthropists who are very spiritually and financially invested in psychedelics, and done by researchers who are also extremely emotionally, spiritually, and financially invested in psychedelics. As a result, there's been very little research or attention paid to risks or harms. Nonetheless, in the last year or so, we're beginning to see some, worse headlines about psychedelic usage. In the middle is Joseph Emerson. He was an off-duty pilot who took magic mushrooms for the first time, had an extended experience of derealization. He felt he was in a dream. And on his flight home, when he was a passenger in the cockpit, he tried to crash a passenger plane because he thought that's the way he would wake up. He ended up being charged with 84 counts of attempted murder, although those charges were then dropped. Matthew Perry, who tragically died in a ketamine-related accident. He'd been receiving ketamine treatment for his addiction and depression issues. And he seems to have been also using ketamine at home, unsupervised, and he drowned in his pool. And there have also been headlines and concerns about Elon Musk's use of psychedelic drugs, including ketamine. Investors in his companies have expressed concerns about that. So we're also beginning to see more research on adverse psychedelic events. Just to give you some of the kind of headlines, 52% of people who responded to the Canadian psychedelic survey in 2023 said they'd had an intensely challenging trip. And 45% of respondents thought that no good had come from this trip. So most people did still feel some good came from this challenging experience, but 45% thought no good had come of it. In addition, about 9% of people in one survey who took psychedelics in naturalistic settings reported functional impairment lasting longer than a day. So difficulties beyond the trip itself, and 6% considered harming themselves or others. In another study, 7% of people reported persisting negative effects 2 to 3 months after naturalistic use of magic mushrooms. In the global ayahuasca survey of 11,000 people who took ayahuasca, 12% said they felt functional impairment lasting longer than a day, for which they sought psychological assistance. People also report extended difficulties under clinical trials. In MAPS trial of MDMA for PTSD, 7% of participants reported increased feelings of suicidality. In Braxia's trial of psilocybin for treatment-resistant depression, 2 out of 30 participants reported severe extended difficulties lasting to the present day, that's 2 years after the trial, which they felt were not reported in the results. One of those participants has now applied for Canada's medical assisted suicide program because she feels she can't bear to live with these difficulties that developed after the psilocybin trial. So our project, we did a survey of extended post-trip difficulties and what people found helpful in dealing with them. We published it in PLOS One in October. We got 608 survey responses. All the people who responded to our survey reported extended difficulties after a trip. So that was our data set. It doesn't look at prevalence, what percentage of people report difficulties. It just looks at what kind of difficulties people report after psychedelics. A third of participants said these difficulties lasted longer than a year, and 1/5 said that these difficulties lasted longer than 3 years. For some people, these difficulties lasted the rest of their life, so far at least. We looked at the kinds of difficulties people report. The most commonly reported kinds of difficulties, by the way, we asked people to describe their difficulties in a paragraph or two, and then we did a qualitative thematic analysis and sorted people's descriptions into 60 different types of extended difficulty. And then we looked for the most common kinds of difficulties. People reported anxiety and fear. So a quarter of our data set reported anxiety and fear. Existential struggle or existential confusion was reported by 17% of people. Derealization was reported by 12% of people. Depersonalization by 12% of people. Social disconnection by 12% of people. Visual distortions by 11% of people. Just to be clear, this doesn't mean that 17% of everyone who takes psychedelics reports existential confusion. That's just how common this is within our data set, which is all of people who reported difficulties. So we're just looking for the most common sorts of difficulties. So we got some very useful quotes illustrating these kinds of difficulties. For example, one participant wrote, "For about 18 months, I awoke with the sun every morning, full of a feeling of absolute terror. Sometimes my anxiety would be so high in the morning that I would physically shake from the energy." In terms of existential struggle and confusion, one participant said, "I entered the experience believing that my experience is the literal, real, external world. Their trip was so bizarre and dreamlike, I could not make sense of it. These memories left a legacy of confusion about what deeper model of reality to use and repeated experiences of flipping between these models at different times." In terms of derealization, one participant wrote, "I had a severe panic attack and went to the emergency room with an ambulance. After this incident, I have had heavily dissociative and surrealistic feelings all day, every day. I still experience these issues daily. It's been almost 2.5 years since it happened." Depersonalization. One participant said, "I spent a long time looking at myself in the mirror, feeling like my soul was missing, like I was a hollow shell of myself and I had already died." In terms of social disconnection, I felt very disconnected from everything and everyone around me. The trip was the most powerful experience of my life, starting off well, but turning into a roller coaster of intense feelings. And here's the key point. They felt that no one around me that I could relate to about it at all. Who can I talk to about this experience? What might make such extended difficulties more likely? Childhood trauma. 40% of our participants reported childhood trauma, which they thought might have been connected to their difficulties. Some of them also had a pre-existing psychiatric diagnosis that probably makes challenging trips and extended difficulties more likely. Age, there is some evidence to suggest younger people are more prone to these kinds of extended difficulties, to these feelings of overwhelm. Lack of preparation, lack of integration support probably makes extended difficulties more likely. In bad settings, so unsafe settings probably make extended difficulties more likely. And then just lack of support afterwards as well, or going back to a hectic, stressful kind of life context probably makes extended difficulties more likely. What helps people who manage and cope with these post-trip difficulties? So we have another paper coming out in Frontiers soon, where from the same survey, we asked people, what did you find helpful in coping with these difficulties? Again, we got a whole range of different kinds of coping techniques, 60 of them. So we tried to just report on what were the most common types of coping techniques. The most commonly cited coping technique that people used was asking a friend or loved one for support. People also reported cognitive self-care practices, particularly compassionate self-talk, just encouraging yourself that you're going to be okay, that this will pass, being gentle with yourself. Also cognitive distancing, teaching yourself to observe difficult emotions or difficult thoughts and not just identify with them immediately. Embodied self-care, particularly exercise, yoga, breathing exercises, and so on, helping people to ground back into their body. Meaning making, finding similar stories, finding helpful literature, journaling. So challenging trips and extended difficulties are like a rupture or violation of your belief system. And so it takes time to weave together a new belief system to help make sense of the experience. And then some people report medication being helpful, and a few also reported a subsequent psychedelic experience being helpful. Though again, there is a risk that that can be re-traumatizing. The essential point from this study is that there is no one-size-fits-all for integrating difficult trips and extended difficulties. Some found a particular technique helpful, like meditation or integration groups, while others found the same technique unhelpful. When people reached out for support from others, they found it unhelpful as often as they found it helpful. So in other words, many people told us they asked friends for help, or a therapist or a spiritual guide, and the support they got was not helpful to them. Why might support not be helpful to someone? Friends, family, therapists, or psychiatrists can dismiss post-psychedelic problems. For example, you go to a psychiatrist, you experience hallucination persistent perception disorder, strange kind of visual effects. And they might say, well, I've never heard of that. That doesn't sound very likely. You're probably fine. Or people might over-medicalize the problem and just say, well, it sounds like you've broken your brain. It sounds like you have a kind of lifelong problem that you're going to need medication for the rest of your life. So people sometimes found that kind of over-medicalized response unhelpful. But participants also said they sometimes found over-spiritualized responses unhelpful. They went to a guide or a coach or a support group, and people said, oh, you just need to trust the medicine, or this is part of your shamanic awakening. Or they might say, you have some kind of negative entity within you, some kind of spiritual response, which people found unhelpful. So there is no one size fits all. If we're trying to support someone dealing with post-psychedelic difficulties, we have to be careful not to impose our belief system, our agenda onto their issues, and try to just listen to them, support them, and provide sympathy to them. People did say they were helped by similar stories of crisis and recovery, and that's something our project is trying to do. Gather stories of difficulties, but also gather stories of recovery. Now, I'm just going to talk briefly about another study we've been working on. We've been looking particularly at existential confusion and ontological shock after psychedelic experiences. This is an interview study led by Irini Argiri at Exeter University. We interviewed 26 people about their extended experiences of existential confusion and ontological shock. Ontological shock basically means confusion about the nature of reality. So psychedelics can lead to profound worldview shifts, for example, from atheist to spiritual. And sometimes that can be very healing. For example, people in one study of psychedelics for end-of-life care said they felt connected to the divine. They came away believing in life after death, and that was very healing for them. However, these epistemic shifts are not always easy to go through. They can be deeply confusing and bewildering. Psychedelic culture can have a Disney-fied view of the mystical experience. This idea that everyone who takes psychedelics has this similar classic mystical experience, which is unitive, you feel connected to all things, peaceful, serene, euphoric, ineffable, and noetic. It gives you this enhanced sense of meaning and purpose to your life. Now, that's sometimes true, but not always. There can be this idea that when you take psychedelics, you have this neatly wrapped mystical experience, which lasts, say, 4 hours, and you emerge the next day with a greater sense of meaning, connection, peace, and so on. But that is not always the case. As we found in our existential confusion study, sometimes the kinds of spiritual, mystical, or paranormal experiences that people have are profoundly confusing. They can be ontologically challenging experiences. For example, people might think, I am God, or all is one, but not in a kind of peaceful way, but in a terrifying way. Or suddenly entities are real in a sense that they'd never thought about before. And this leads to profound existential confusion. How do I make sense of this experience? What the hell's going on? And this can lead within the trip to this feeling of terror, of overwhelm, and also this kind of no exit experience. I'm stuck in this hell type experience and it's never going to end. Now, those kinds of terrifying trips can lead to extended feelings of existential confusion for weeks or months or years after the psychedelic experience. As we analyzed in this interview study, people can emerge with a greater sense of existential confusion. What does that mean? What is real? They can emerge with higher anxiety, feelings of social disconnection, who could possibly understand this experience, and other cognitive, behavioral, and somatic problems. So here's one quote, for example. The psychedelic experience was so powerful that it fundamentally challenged my perception of reality and how well I could trust my perceptions in the day-to-day. I just wasn't 100% sure whether I could ever really trust my sense of what's actually going on. So that destabilized sense of reality. And people often emerge kind of thinking, I need to make sense of that experience, but it's very hard to make sense of it. So here's another participant. I wanted to understand existence somehow, and I knew I couldn't. In this DMT high, you feel like you can understand more things. Then you come back down and you're like, what the heck? This wanting to understand the meaning of it or of the universe or of existence, and then just not being able to take no for an answer. So there's this obsessive preoccupation with making meaning. So again, we asked, what's helpful for people dealing with extended existential distress? Grounding and embodiment, coming back to the body. So a lot of people in our study said that they practice things like yoga or exercise or trauma release to come back to the body. Reframing the experience as an inner mental state rather than a cosmic fact. So, on psychedelics, people might have an experience of hell or of the total meaningless of the universe. And then they come out and they think, is that true? Is that a true a snapshot of the ultimate nature of reality. And sometimes it's helpful for them to realize, no, that's just a reflection of my mind. That's not ultimate cosmic truth. So this person says, the trip showed me in what direction my mind was pointed. What I experienced was not true objectively. It was simply true and relevant to me at that moment in time. And also social normalization. So one participant said, having someone say that it's just like a normal thing that happens, I remember it being really reassuring. So you can imagine when people have any kind of psychedelic experience, they're coming back to a culture where these kinds of experiences are not normal and they're not common. And that can increase this feeling of social isolation. So it could be helpful to find other people who'd say, oh, my experience was like that too. Or I also experienced extended difficulties after psychedelics. Okay, for the last 10, 15 minutes of my talk, I'm just going to talk about the newsletter we started as well. We also started this a year and a half ago. It's called Ecstatic Integration. It's a Substack, and I'd love you to subscribe to it. And what we ask in this newsletter is, how can we reintegrate ecstatic experience back into Western culture wisely and relatively safely? How can we improve the West's ecstatic literacy? What I mean by ecstatic literacy is how we relate to ecstatic experiences and how we make sense of them. At the moment, we're an ecstatically naive culture. We don't have a grounded, settled cultural way of relating to ecstatic experiences. We're quite immature in how we relate to ecstatic experiences. So becoming more sophisticated and mature would involve things like recognizing ecstatic experiences aren't always literally true. They're not always healing. They're not always proof that your guide or shaman or guru is a holy person. They're not always proof that you're a holy, special, evolutionarily advanced person, and so on. So we need to improve our sophistication in how we relate to ecstatic experiences, to improve our discernment and discrimination with how we relate to ecstatic experiences. One important way to do that is through education about ecstatic suggestibility, how ecstatic experiences, including psychedelics, amplify suggestibility, and how people can take advantage of your suggestibility on psychedelics or in trance states or in hypnosis and so on. So let me give some examples of people taking advantage of suggestibility in psychedelic culture and psychedelic industry. For example, psychedelic organizations giving like NGOs, like retreat companies and so on, giving people drugs and then asking them for funding while they're under the influence of psychedelics or in the afterglow state. Let's say you're a psychedelic church. You give people psychedelics and then say, now give me thousands of pounds. Or you're a psychedelic charity or a research organization or a clinic or a retreat center. That is unethically taking advantage of people in suggestible states. Or let's say you're a psychedelic retreat company and you ask people for a testimonial video the day after they've taken psychedelics at your retreat. Many psychedelic retreats companies do this. And then they post these videos on their website or on YouTube of people still very much in the afterglow state, saying, wow, that was incredible. That was the most amazing experience of their life. I would suggest that is unethical. You're taking advantage of people in a suggestible state to promote your own company. And there's also many instances of psychedelic facilitators, therapists, guides, and psychiatrists taking advantage of clients' vulnerability for money, for sex, or for power. So now this is a controversial site because some of the page because some of these cases are still in court. So these are alleged cases of psychedelic abuse. There's the MAPS incident, for example, where one participant in MAPS's trial of MDMA for PTSD she ended up in an abusive and unethical relationship with the facilitator, living with him, promoting psychedelics at MAPS conferences, having sex with the facilitator. And she came to think that, quite rightly, that this was an unethical and abusive relationship. There's also the case of the Center for Conscious Medicine, run by Françoise Borzat and Aaron Grossbart, where clients and patients were kind of, sexually abused by the leaders of this group, and ended up working for them in a kind of unpaid ways. So there were all kinds of blurred lines and dual relationships, multiple relationships, which are unethical and abusive. There's the case of Dr. Ben Sessa in the UK, one of the most prominent figures in the psychedelic renaissance. He actually coined the phrase psychedelic renaissance, and his medical license was suspended 2 months ago after he unethically started a relationship with one of his patients. There are several other incidents around the world of psychiatrists using ketamine to abuse patients, taking advantage of them while they're in a suggestible and dissociated or even unconscious state. There's a law case going at the moment about the East Institute in Georgia. Several women have accused the founder of the East Institute of sexually assaulting them, or also taking advantage of them financially. There's a case that my newsletter is reporting on this Friday coming, about a Peruvian shaman who has abused multiple women during ayahuasca ceremonies in Europe and in Peru, also financially extorting his followers for tens of thousands of euros. And there are many, many more unreported incidents. There are far more incidents of psychedelic abuse than there are journalists to report on them. So this is just the tip of the iceberg. By the way, if anyone watching has experienced psychedelic abuse, there's a new organization called the Shine Collective, which is a support group for victims of psychedelic abuse. Now, psychedelics can also amplify cultic social dynamics within psychedelic organizations. How do they do this? 3 ways. This is based on a paper that Joseph Holcomb Adams and I are about to publish on psychedelics and cultic social dynamics. First of all, psychedelics amplify suggestibility and transference in those taking the drugs. What transference means is people on psychedelics can feel this tremendous, they can project these idealized feelings onto the people giving them psychedelics and think, wow, you're such an enlightened person. You're so special. You're so attractive. You're so holy. Secondly, psychedelics can amplify ego inflation and countertransference in those giving the drugs. They can think, yes, I am so special. I'm so holy. I'm so attractive. And they get very ego inflated and even can get into kind of messiah complexes. And then thirdly, psychedelics can amplify what we call cultic social dynamics. Now, what we mean by that is we define a cult as a group with strong shared beliefs and a way of life, which makes high demands on its members. Now, cults can be relatively healthy or very unhealthy. So just calling something a cult doesn't mean it's toxic. There is a continuum of influence, a continuum of authoritarianism at which these kinds of cultic groups can be at different points on the continuum, as Dr. Steve Hassan has written. What kinds of features characterize a cultic group? They might have shared mystical experiences. After a mystical experience, a kind of conversion to a new cult self, shared rituals, shared terminology, shared dress, shared diet, a devotion to a charismatic leader. The individual self is dissolved into the collective self, a strong sense of in-group. We in the group are special. Everyone outside of the group is unawakened, and we should perhaps avoid them. A utopian goal. We are saving the world. A sense that the ends justify the means. So, we have such a holy utopian goal that we should keep silent about any kinds of harms or abuses that are taking place. High conformity to the group culture. And also sometimes anyone who leaves the group is demonized and dissociated from. Now, none of those characteristics are necessarily abusive. So most religions would tick some of those boxes. There were also groups like, for example, the Grateful Dead, kind of is a cult, with deadheads, but it's not really a toxic cult. It's quite a kind of benign cult. So I'm not saying that cults are always toxic. However, all those characteristics make abuse more likely to occur and more likely to go unchecked. And psychedelics amplify all those dynamics that I've named above. So there's a risk of psychedelic organizations that includes research teams, retreats, training schools, non-profits, and so on, kind of becoming cultic, and that leading to unchecked abuse. I'm not saying it always happens, it's just a risk. Okay, in conclusion, I'm just going to suggest as you can tell, I have some skepticism about the psychedelic movement. And I'm going to end with just 4 reservations I have about the future of psychedelic therapy. The first, as I've discussed in this talk, I believe that psychedelic effects are unpredictable. They are not reliable. They are unpredictable. They can be extremely good, but they can be quite bad and lead to these extended difficulties. And at the moment, there is no safety net for the 10% of people who experience extended difficulties. And I think that's a serious ethical problem with psychedelic culture. There's this massive hype encouraging people to take psychedelics, including vulnerable people, and yet there's no safety net. There's very little research on psychedelic harms. There's very little research on what helps people who experience psychedelic harms. There's very few support groups for people who experience psychedelic harms. There's very little training on what helps people who experience psychedelic harms. So there's just this lack of a safety net. Secondly, it looks likely that psychedelic companies will ditch the therapy aspect of psychedelic-assisted psychotherapy to reduce costs and to get regulatory approval. The reason for that is regulators like the FDA or the European Medicines Association in Europe are not set up to assess psychotherapy. And drug companies are realizing that, and they're minimizing the therapeutic support aspect of psychedelic treatments in order to get regulatory approval. What that means is there's even less of a safety net for people who apply for psychedelic treatments. Thirdly, in my opinion, psychedelic science is an overhyped medico-religious enthusiasm. It's a kind of spiritual movement. People are deeply spiritually invested in it. And enthusiasms tend to overreach and then fade away. That happens all through the history of medicine. And I think there is a risk of that with psychedelics as well. And finally, I believe that psychedelics, it's possible, I don't know, but it's possible that psychedelics open us up to the spirit world in ways we don't completely understand. And there may be spiritual risks we don't really know about and we don't really understand. Now, I did a survey last month of 129 people who work in the psychedelic industry as guides, therapists, neo-shamans, coaches, and so on. I asked them, do you believe in the existence of spirits, entities, or non-human intelligences that one can encounter on psychedelics? Over 70% said they did. I asked them, do you believe in malevolent spirits or entities which can attach themselves to people? 55% of them did. I asked, do you think psychedelics can open us to the spirit world in good ways and bad? 70% of people working as psychedelic guides, facilitators, and therapists did think that psychedelics can open us up to the spirit world in good ways and bad. I asked, do you think people working with psychedelics should be trained in how to engage with the spirit world? 62% thought that they should be trained in how to engage with the spirit world, but less than 40% thought that they personally were trained and qualified to engage with the spirit world. So I think what's happened with the psychedelic movement is this activity, this culture from New Age, the New Age subculture, is now trying to go mainstream and position itself as the future of Western medical healthcare. But there are these unanswered questions like, does it open people up to the spirit world, in ways we don't fully understand? I don't see how could the FDA ever kind of include like something like may lead to spirit possession or may open you up to malevolent entities on its warning labels for psychedelics. So I think there's a bit of a culture clash between, on the one hand, the New Age subculture that psychedelics have emerged from, and on the other hand, mainstream Western healthcare. And I think that's a real challenge for psychedelics. As a solution, I think we might be able to weave a better safety net for psychedelic culture. We could do that three ways. Firstly, by learning more about psychedelic harms and psychedelic harm reduction, more research on the kinds of difficulties people experience and what helps them avoid those difficulties or manage them or heal them. Secondly, we need to communicate better about psychedelic risks. Journalists need to communicate better about psychedelic risks. For example, it's very rare in articles about ketamine therapy for there to be anything about the fact that ketamine can be addictive. So we need to be more honest about the risks of psychedelics as well as the benefits. And then finally, we need to support those who experience psychedelic harms. Make sure there are support groups, that there are trained therapists, trained psychiatrists. If you promote the psychedelic industry without a safety net, that to my mind is unsafe and unethical. Okay, so that's my website. That's my email address. And my newsletter is ecstaticintegration.org. And the Challenging Psychedelic Experiences Project can be found at www.challengingpsychedelicexperiences.com. Thank you very much.
Thank you for such an amazing talk, Jules. And I think this is a really important topic to discuss. And we already have some questions on the Q&A. And for those of you who have questions and would like to ask them, please consider writing them there. And before I start taking questions from the Q&A, I will open with a few questions of my own. So there seems to be a lot of mystical language around psychedelic experiences, and this language extends to even proposed mechanisms of action and the training of psychedelic therapists themselves. So could you tell us about the concept of the inner healer and how this way of thinking about psychedelic therapy can go wrong?
Yes. Okay. Several psychedelic therapy modalities but particularly the MAPS modality, so the MAPS protocol for psychedelic therapy, but also to some extent the Gestalt modality, and also to some extent the internal family systems modality, has this idea that that we have a kind of inner healing intelligence, a natural inner healer that we can connect to, and that psychedelics reliably help us to connect to this inner healing intelligence. So now sometimes that's explained in naturalistic ways, like just as when you break a bone, it naturally heals. So when you damage your mind, particularly with trauma, your mind naturally seeks healing. But it also sometimes has a spiritual meaning to it as well. Like we literally have a kind of inner guide, like a guardian angel that we can connect to through psychedelics or prayer and so on, like an inner kind of shamanic spirit. This is a central idea in MAPS's protocol for psychedelic psychotherapy for PTSD that they've submitted to the FDA. And it's a very common idea as well. Now, some people say that there's nothing, that this could be a helpful idea. It's helpful because it's, it has this idea that, you have a kind of natural healing capacity within you. So that can be encouraging, if a therapist says to you, like, you can heal, there's something within you that can help you heal. Could be empowering to the patient rather than saying, I, the therapist, am healing you, or the drug is healing you. It's like you have this healing within you. And it could be helpful if it's just a metaphor. Look, when we wrote this book, Breaking Open, about spiritual emergencies, people did find the frame of a spiritual emergency helpful, which is the same idea that maybe this is part of a healing process. Maybe your psyche is seeking wholeness. So people can find that frame helpful. When is it not helpful? Well, let's imagine that people have new medical difficulties as a result of their psychedelic experience, like insomnia or tinnitus or somatic problems or increased anxiety. And their therapist says, just trust your inner healer, trust the medicine. But that might not be helpful to them. That's kind of over spiritualizing it. It's overly glib. Sometimes psychedelic experiences don't help you. Sometimes they harm you. And people need new support. So there is a risk that the concept of the inner healer can lead to this laissez-faire attitude. We've had people contact our project who did a psychedelic experience with an underground guide, sometimes following the MAPS protocol. They ended up having severe difficulties after the experience, and they contacted the guide, and the guide said, just trust the process, just trust the medicine. And the client did not find that to be helpful. They found that to be not taking responsibility for things having gone wrong, that, putting it on them like it's their fault for not listening to their inner healer. So you can see that it can be a way of actually dismissing severe difficulties after psychedelics.
Yeah, thank you. That's a really good answer. And I agree that it can also subtly start to shift the client's worldview toward this kind of place where instead of it being a metaphor for the brains and body's capability to reorganize, it starts to remind one of some kind of an entity that does the work, and also that the responsibility can be shifted on.
Yes. Well, this is a big issue because therapy, ideally, the therapist takes a position of ontological neutrality. They do not impose their metaphysical worldview onto the client. If I went to see a GP in the UK about a health issue and the GP suddenly read my horoscope or started, chanting or kind of gave me a passage of the Quran to read, I would think this is not appropriate. Likewise, if you go to a therapist and they said, well, this probably sounds like your past karma, that would be inappropriate. Now, this is a real challenge for psychedelic therapy, because in psychedelic experiences, people do have metaphysical experiences, entity encounters, mystical experiences, and so on. So how does the guide or therapist support the person, but without imposing their metaphysical or ontological worldview? Now, some of the leading therapeutic modalities are spiritual, and they do have ontological beliefs to them. For example, Stanislav Grof, one of the leading kind of figures in psychedelic therapy, believes in astrology, and that's central to his worldview. Internal family systems, believes in unattached burdens, which is their word for kind of malevolent entities, which have entered you and are not actually part of you. So there's also many kinds of, shamanic influenced therapies. Or the inner healer can be this kind of shamanic idea of a kind of guardian angel. So there's many ways that the kind of a poorly trained therapist or guide could impose their own ontological beliefs onto a client before the session, during the session, or after a session. Let me take another example. There's a retreat center, a leading ayahuasca retreat center called Taquewasi in Latin America. And there was a study by David Dupree of this retreat center, which found that people who went to this retreat center were trained to interpret their hallucinations in a kind of Catholic shamanic frame as demons, which need to be kind of exorcised through grace and deliverance and the Holy Spirit. So there's many ways that people can be influenced to make sense of their experiences, in ways that would not be aligned with traditional therapeutic ethics.
Yeah, that's a great point. My other question is related to a topic that has much connection with the previous one. That the most common extended difficulties like anxiety, existential confusion, derealization, and depersonalization, and also social disconnection seem to have a lot of overlap with symptoms of post-traumatic stress. And when one reads about how psychedelic guides and enthusiasts talk about the risks of psychedelics, you often hear about temporary fear being common, and then all you need to do is during such experiences just to let go. But however, this letting go approach seems to not always work, and extended symptoms with fear and dissociation are a serious side effect we should not underestimate. And I'd like to hear your view on how these extended difficulties could be properly communicated to potential patients who think about starting some form of psychedelic therapy.
Mm-hmm. So you're absolutely right that we have seen similarities between some of these extended difficulties and post-traumatic stress disorder. So people are effectively being traumatized by their psychedelic experience. This is completely unsurprising. A positive psychedelic experience, people say it's one of the best experiences of their life, one of their top 5 experiences, perhaps the best experience of their life. But challenging experiences are classified as one of the top 5 worst experiences of their life, perhaps the worst experience of their life. People feel existentially threatened, like they're going to go crazy, they're going to lose their mind, or they're going to die, or that they're in hell. And because psychedelics distort your sense of time, people can sometimes feel like they're in hell for eternity, or for months or years. So unsurprisingly, they would be traumatized by this experience sometimes. But there are no articles published on post-psychedelic trauma. It's one of many examples of extended difficulties after psychedelics where there's no published article on it. We have some reports in our survey, and there's some mention in other reports, but no specific studies on it. Another example is people talk about reactivation, or what used to be called flashbacks, after bad trips. So, for example, people after an ayahuasca ceremony, for several nights afterwards, they might wake up tripping again, as if they're still on ayahuasca, and they're like, "What's going on?" This is like a week afterwards, or weeks afterwards. Again, there's very little, hardly anything published on what's going on there, neurologically, phenomenologically, or what you should do about it. So that's what I'm talking about, this lack of research, all these research gaps on these issues. And then in terms of what helps people, it would make sense that the typical kinds of things that help people with non-psychedelic PTSD might also help people with psychedelic PTSD, like support, empathy, types of talking therapy like cognitive behavioral therapy, somatic practices to regulate the nervous system, social support to normalize the experience, and then sometimes, but rarely, further kinds of altered state experiences to re-enter that altered state and to somehow feel less overwhelmed by it. But of course, there are risks to that as well. Yeah, but so like just to say, like thousands of American veterans are being encouraged to take psychedelic treatments for their PTSD. Either self-medicate or to go to psychedelic charities or to take part in psychedelic trials. And a percentage of them will be re-traumatized. Their trauma will be exacerbated. And, guess how many papers there are on re-traumatization by psychedelics? Guess how many support groups there are for veterans? Zero. It's so irresponsible to encourage a vulnerable population towards a treatment without any research or any support for people who have difficulties after psychedelic experiences. Instead, veterans are being used for marketing purposes and for lobbying purposes to make psychedelics legal. Okay, fair enough. A lot of veterans have been helped by psychedelics, but if you're going to encourage veterans towards psychedelic treatments, don't you think you should have support in place for the percentage of those who have difficulties?
Yeah, thank you for your answer. That's a really important under-researched topic. My last personal question is related to the one of the four principles that you mentioned, which is the unpredictability. Psychedelics can have very unpredictable effects, and that unpredictability seems to be a part of their nature. And in the 60s, people who used LSD used sometimes to blame bad acid for their bad experiences. And also, indigenous shamans can blame some failing in their ritual or someone not taking the proper diet, etc., for the ceremony going wrong. And these approaches seem to try to make something really unpredictable into something that they could manage if only they could like do everything right. But there could be a genuine uncertainty into how things are going to turn out. And my question is that could our medical system that is built upon the scientific project of prediction and control be able to use psychedelics as a therapeutical tool at large scale due to this unpredictability?
I completely agree. I mean, there's things I think that's what we're all trying to figure out. And there seem to be ways you can maybe reduce some risks, for example, with drug testing. Being careful about what you're taking. I mean, like, in some ayahuasca ceremonies, the ayahuasca might be mixed with other things as well. Or in some retreats, they might mix ayahuasca with Kambo treatments or with DMT. When people are taking psychedelics naturalistically, they're often smoking cannabis at the same time or mixing multiple psychedelics. People are often taking psychedelics without any preparation and in bad settings. That probably makes difficulties more likely. Nonetheless, we still see difficulties under the safest conditions. We still see very experienced psychedelic people like Terence McKenna suddenly having very bad psychedelic experiences, which pretty much put them off mushrooms in Terence McKenna's case. So I think it really is unpredictable. And we also see that you made exactly the right, good point, which is that Western drug treatments are based on the idea that these treatments will work no matter what the setting. They will always reliably work no matter what the setting, no matter what the kind of social context. Psychedelics seem very different. They amplify the context you're in, and the context you're in can very much influence and determine the kind of experience you have. Um, and yet, again, do you know how many studies there are looking at how different contexts, comparing different contexts and different outcomes? Hardly any. So this fundamental idea of psychedelic wisdom, like be careful of your set and setting, there's pretty much zero research on that, comparing different settings. What that means is, as psychedelic treatments have been rolled out, they're often provided in bad settings. In Oregon, for example, because of zoning laws, you can only legally take psychedelics in urban settings. You can't take them in the countryside. That's just because of Oregon planning laws. So, they're not very nice settings. In some clinical trials, people have been given psychedelics in small rooms without windows, without any kind of empathetic support. And guess what? They've had real difficulties that have lasted for years afterwards. So I agree with you. Maybe the biggest challenge for psychedelics is that they're unpredictable. And as more and more people take them, more people will report these kinds of unpredictable effects. And they contact our project. We get contacted every week by people saying, I did magic mushrooms or I did ayahuasca. Sometimes they're experienced, sometimes this is their first experience. And then for some reason, they just have these difficulties, which can be very severe and can last a long time afterwards. And they often be very unusual, like, tinnitus or insomnia or somatic issues or light sensitization, or feeling possessed, or just higher anxiety. Now, your last question was, how do we communicate these risks? Again, that is not an easy question. If we're going for a psychedelic session, do you really want someone to read out all the ways it can go wrong? This is what some people say to us. They say, you shouldn't even be talking about this because you might make these things more likely to happen. Because psychedelics are self-fulfilling prophecies, so only talk about the positive. But then the risk of that is then when people have difficulties, they're like, well, no one talked about this. So I think you can mention some of these difficulties without talking about them too much. And then afterwards, you can monitor your clients and your patients and see, are they experiencing difficulties? Are those difficulties severe? If so, you need to provide intensive support to people in the weeks afterwards to make it less likely that those difficulties get kind of set into people's neural pathways and become chronic conditions. So I think that if there is going to be a psychedelic industry, it needs to make sure that there is intense, good support for the 10% of people who have difficulties afterwards to reduce the length of those difficulties. That could be peer support, therapy support, and psychiatry support. It's not one size fits all. So you can't say, here's a peer support group, or here's medication, or here's, a book on spiritual emergencies. It needs to be kind of multifaceted. So that would be the minimum, I would say, that the psychedelic industry should do to try and become viable as a long-term kind of industry.
Thank you. I think that's a really good answer to a very complex question. I will now start taking questions from the Q&A. And the first question I would like to start is, just a moment. It's from an anonymous attendee, so perhaps I will read it myself. Uh, do you think there are harmful social or cultural structures or practices also in academic research on psychedelics uh, that increase the harm that these substances could do to people?
Yeah, there are trials that don't seem to have been run well. I wrote about I'm sorry to pick on them because the Braxia did a trial of psychedelics for severe cases of treatment-resistant depression. And in a way, they should be applauded for trying to take on very difficult cases, which other trials would probably screen out. So they're trying to help people with severe, mental health problems. But the trial did not seem to have been run well. It was not in a good setting. People were encouraged to taper off their antidepressants too quickly. The support during the sessions does not seem to have been ideal. And then there seems to have been, in some cases, a lack of support after the trial. So trials can be done better or worse. In terms of empathetic support, before, after, and during the trial. Secondly, research teams can be more or less scrupulous and honest about how they report bad outcomes. Many research teams, well, there have been papers done, for example, by Brexima and by Eco Fried and Michael Van Elk. Those are two different papers that have found systematic underreporting of adverse events on psychedelic trials. And the reasons for that is, well, there might be many, but conflicts of interest is that psychedelic researchers could either be extremely spiritually and emotionally invested in psychedelics, so they have a confirmation bias, or they're financially motivated to minimize episodes of harm or adverse events. So that's a problem. So but I know that the psychedelic industry is trying to take this seriously and trying to be better at reporting adverse events. And there's also, the question of how much support these trials provide. So some trials are trying to reduce therapeutic support and reduce the costs of psychedelics. Well, that would be great if it works because it means psychedelic treatments will be cheaper. But there are risks that if people have bad outcomes, they have much less support. So it remains to be seen how much support is necessary in these treatments.
Thank you. The next question in the Q&A is by Matt Siegel. So, if there is an adequate campaign to make the risks of psychedelics apparent to the general public, which while real, it seems to me that they are much lower than, for example, alcohol. Would you agree that far less harm would come from across the board if we would decriminalize the classic psychedelics?
I don't know. On the one hand, there are clearly some harms connected to psychedelics which emerge from them being criminalized. The harms connected to criminalization would be the risk that you're not buying what you think you're buying, the risk that you go to an underground illegal guide or center and there are no standards of safety, and you experience some form of harm or abuse, which you then don't report because you were doing an illegal activity. The risk that because it's illegal, that informs your trip, that you get paranoid, that you don't tell other people about it because you feel it's stigmatized, because you're ashamed of it. So I can see that criminalization increases certain risks. However, decriminalization also increases certain risks. It makes, particularly, it depends on the decriminalization campaign. In the US, decriminalization and legalization campaigns often have not mentioned the risks or harms of psychedelics. Even leading kind of champions of psychedelics admit that. So what that can do, it can increase psychedelic hype, encouraging people to go to take psychedelics without proper informed consent about the risks. Also, psychedelic legalization and decriminalization is just making psychedelics more available. So more people are going to take them, and so a greater, number of people will be harmed, because there's just always going to be that percentage of people who will be harmed, I think, because people still experience harm under safe conditions. Also, in decriminalization, there's still this kind of gray area over what's legal. So, for example, in Oregon, psychedelics have been legalized under regulated settings, but also they were decriminalized. They're not anymore. And what happened was all kinds of opportunistic companies sprang up, selling psychedelic sessions, psychedelic retreats for thousands of dollars, often with zero training, zero safety protocols. So there is a Wild West element to the psychedelic market at the moment that may change. I mean, a bit like the alcohol market in the 19th century, you could say, when you didn't know what you were getting. It could be moonshine, it could make you go blind. So that could change as the field becomes more mature. So listen, I don't take a policy position myself. I'm agnostic about how people take psychedelics, whether it's legalized, illegalized, decriminalized. I'm trying to work to improve information and reduce harm, however people take psychedelics. So I put forward different kinds of arguments about that. I mean, I know, I'm in favor of good training for psychedelic guides. And if there is training for psychedelic guides, I'm in favor of it, including information about psychedelic harms, how to avoid them, and how to help people if they experience them. And I'm also in favor of honest communication about psychedelics, no matter what the policy framework that different bits of the world decide on.
Thank you. The next question in the Q&A, I'd like to invite this question by Aleksi Hupli, and I would like to invite Aleksi to read his question out aloud.
Yes, thank you. Can you hear me?
Yes, hi, Aleksi.
Hey, thank you very much for a great webinar talk discussion. I was just wondering, because you were showing prevalence rates in the beginning, do you think the increase of the psychedelic use could be partly due to people self-treating themselves during the pandemic? Because it was like kind of before and after that period.
It's a very interesting point. I don't know, but that sounds like a good theory to me. And certainly anecdotally, we came across several accounts of that in our kind of survey responses. People who during the pandemic got very into psychedelic self-medication and psychedelic experimentation, often doing a lot of psychedelics on their own, and then, sure enough, having very difficult experiences and having to then go through that on their own without kind of support. So that would make sense to me. I'm curious to see whether, uses continue at those high levels or continue to grow now. My sense is they're not going down, that, that more and more still are trying psychedelics, often on their own, often self-medicating.
The next question I would like to take is from Reetta Ojala. When people reported their previous psychiatric diagnosis, did you review the prevalence of different diagnoses? If yes, which psychiatric disorders were the most common?
It's a good question. No, we didn't. We just asked people, did you have a previous psychiatric diagnosis which you think may have contributed to the difficulties? And I believe it was about 30% who said yes. We didn't ask what type. Another paper that I know of from Imperial College found a correlation between extended difficulties and personality disorders. So that paper suggested that personality disorders makes extended difficulties more likely. But I asked the authors, are you saying that everyone who has extended difficulties after psychedelics have personality disorders? Because and they were like, no, absolutely not. But it just, that group, that's one group that's been found, it's more likely that they have difficulties. Well, I mean, we did ask, did you have, in our survey, we did ask, did you have an experience of childhood trauma, which you thought may have contributed to the difficulties you experienced after psychedelics? And 40% said yes. But I should mention another paper by Senia Cassidy and others looked at difficult ayahuasca experiences, and it asked people, did you have ever childhood adversity or trauma? And that study did not find a correlation between difficult ayahuasca experiences and childhood trauma. So we're still learning on whether mental health conditions or trauma make difficulties more likely. To me, it's likely that they do. Psychedelics are sometimes mismarketed as 10 years of therapy in one night, as in one magic night your problems will be resolved. And that can be the case, but often it's the case that they can more kind of bring to light your issues, bring them to the surface, which then gives you an opportunity to maybe work through those difficulties. But that happens after the psychedelic experience. So it's not necessarily just this magic resolution in one night.
Thank you. The next question I would like to take is from, just a moment, I lost it. Yeah, from Jonah Stabinski. And I would like to invite him to read his question out loud if you want to.
Hi. So Jules, an amazing talk. I was curious if any of your studies has studied the relationship between extended difficulties and dosage taken. So anecdotally, in my life, the people who have had extended difficulties took large doses of the drug, so-called heroic doses, or even something much larger than any study would recommend. Obviously, it would not be the only reason to have extended difficulties, as your talk shows, but I'm curious if you feel like it is a major one.
We did not do that in our extended difficulty survey. We just asked, did you know the dose? And I mean, unsurprisingly, we did find some correlation between not knowing the dose and, numbers of difficulties. But it wasn't something we looked at, really, but it is something that others have researched and suggested. So there is a paper by Rebecca Bremler from Imperial College, and it's a good paper, and she suggests certain things that make extended difficulties more likely. And Bremler suggests that young age is one of them, high dose is one of them, bad setting is one of them, pre-existing psychiatric issues is another of them, and lack of support afterwards. And certainly anecdotally, in some of the responses, yes, people were doing either just very frequent use of psychedelics or very high uses, but again, not always. Some would be doing kind of mid doses, like say 2 grams of mushrooms or 3 grams, and still having problems. But yes, I think there will be. I think it would make it more likely, because often what's terrifying for people is feeling overwhelmed during the experience, feeling out of control, feeling like it might never end, and that kind of overwhelm is more likely on higher doses, or if it's your first time. So if we're thinking about how to target public health messaging. People often say things like start low and go slow. But I also think it's like, first timers who are not familiar with altered states of consciousness or with the psychedelic states of consciousness and might be overwhelmed by it and traumatized by it. How do we communicate, public health messaging to those kinds of first-time people, including people who try ketamine, by the way, which has become an incredibly popular treatment in the US. But it can be overwhelming for people. People can, the podcaster Scott Galloway, who does the, I think it's the Pivot podcast with Kara Swish. He did ketamine therapy the other day and he reported on it. And he said, this would have been really scary if he wasn't familiar with psychedelics before. It was a profound alteration of consciousness. So I'm interested in how we might prepare people for those kinds of profound alterations of consciousness beforehand, maybe through holotropic breath work, maybe even through kinds of virtual reality experiences. Anyway, in brief, to answer your question, we didn't look at it, but I suspect there is a correlation between higher doses and extended difficulties.
Thank you, Jules. I would like to take some anonymous questions next. And the first one is, what is your view on the use of psychedelics among couples, especially where there are issues within the relationship? And it's used by some in groups, etc., to create a culture bond, which can occur in members who are paired, etc. And in MDMA and couples therapy, given the tricky topic of how to navigate domestic abuse, control, and using pharmacology to effectively force a bond or keep people together.
Wow. I think it's a great question. It's not something I've written about yet. Others have. I believe that I might be wrong, but there have been some papers on it. I think Sarah McNamee might have written on this. If you want to Google her name, Sarah McNamee. I know that there's another paper coming out by Clerkenwell Health, by that team, looking at a patient who took part in a psychedelic trial, and they came back and they had a kind of insight that the relationship they were in was toxic, and they went back to a abusive home environment, and that led to kind of that severe difficulties, which were kind of part of the treatment. It just kind of and they're publishing a paper on that, just on the how psychedelic treatments can interface with the context, the domestic context that people can go back to, and how that can be an abusive context. I also think that, yes, it's possible that people, that abusers in relationships could use psychedelics to try and take advantage of their abused partner in various different ways, to try and kind of keep them in a toxic relationship, or to take financial advantage of them, or to take sexual advantage of them. I know of one instance where a very wealthy man in Silicon Valley was in a very acrimonious separation legal case with their partner, and this wealthy man met up with his ex-partner, gave them MDMA, and then the next day got them to sign a separation agreement, which was very advantageous to the wealthy man and not to the woman who was, suing him. And she subsequently felt she was taken advantage of with psychedelics. So, I mean, we have to be careful, all of us in romantic and sexual relationships, of power imbalances and of taking advantage of our partner and mistreating them. And psychedelics kind of complicates it further, So complicates the risk of kind of undue influence, of coercion, and so on. So that's kind of some answer, but it's not something I've thought about. I think it's a fascinating question and really deserves being written about and researched. And just very quickly on the idea of psychedelics in group contexts, yes, there are all kinds of ways that can lead to kind of cultic dynamics. In our research, we came across one participant who was in an ayahuasca group in London, and she was invited by someone else in the group to an ayahuasca session. And there were, then he invited others there, and suddenly in the middle of the session, it turned into a group sex session. And she had not been informed about this in advance. And she took part in this group sex session, but afterwards felt very bad and abused, and even kind of possessed, in fact. And so there are certain issues there. Like, there are groups that mix together psychedelics and various kind of group sex exercises. And if groups do that, they need to be very, very clear long before people turn up and long before they take psychedelics. Hey, by the way, we're a psychedelic group sex group. We're a polyamorous psychedelic group, so that people can say long before they take psychedelics, okay, I'm up for that or not. So you need to be extremely careful with informed consent in those kinds of situations. And there may be other kinds of risks we don't know about. It may be that psychedelics open us up to the spirit world. It may be that sex also opens us up to the spirit world. So we don't know that it may be possible that sex with people on psychedelics leads to energy transfers that we don't understand. I don't know. All I'm saying is that's something we don't know.
Thank you, Jules. There's a question related to the same theme here by Andrew Hamilton. Have you studied, or do you know of studies on the prevalence of sexual abuse, including rape, during psychedelic experiences?
The paper that's most often cited is Sarah McNamee and her co-authors, which came out, I think, in 2023. Then that's I think, one of the few academic papers. And then there are many, if you look on the news, on Google News, you'll find many others. There are many examples of, like I said, ketamine psychiatrists who have taken advantage of patients to have sex with them when they're either under the influence or unconscious. There's another case recently of a ketamine psychiatrist who spiked a woman's drink in a bar and then raped her with ketamine. There's the Ben Sessa case where he ended up in a kind of unethical sexual relationship with a patient. So there are many instances of ayahuasca shamans having sex with women, or sometimes raping them, in all cases abusively and unethically, during ceremonies or after ceremonies. They generally go unreported. Yes, the most famous instance is the case during the MAPS trial. But then I would also encourage you to read Will Hall. He was a client of the Center for Conscious Medicine, run by Françoise Borzat and Aaron Grossbart, and he has talked about his experience of abuse in that setting. And then my newsletter has written about instances of sexual abuse in Gestalt schools in Latin America and in Spain, and and then multiple other instances of sexual abuse. So, then there's also the East Institute trial that I mentioned. Anyway, but the only academic paper that I'm aware of is by Sarah McNamee and co-authors.
Thank you. I have one question related to this theme about entities and energy transfers, because you have written a few posts about the entity encounters people can have with psychedelics. Is there any way that this could be fruitfully discussed in academic settings, and how should we approach the topic seriously?
Well, you can approach it phenomenologically, that this is just an experience that people have without taking a stand on whether it's real or not, or what it is. So, and research teams have done that. Johns Hopkins did a study of entity encounters, which just said something like 70% of people who took DMT and who responded to their survey reported entity encounters, of which something like 15% found it a kind of malevolent entity. So Johns Hopkins did not take a stance on whether the entities are real or not, because I don't think an academic team is ever going to be able to prove whether an entity is real or what it is. Forget it. And and I think it's unethical for a therapy to take a stance on whether it's, to say this is definitely real or definitely not real. Just, that people have these kind of experience. And then what does that like? And then what is helpful for them to support them in that experience? So I suppose that will be the way to study it. In terms of what might protect people against entities, the core idea in shamanic cultures, in psychedelic rituals, is that psychedelic plants open us to spirits, which can be helpful allies or harmful kind of weapons against us. And the job of the shaman, their job is basically to call in helpful spirits and protect you from bad spirits. I do not know how that could be, studied academically. What are you going to take, one group that is not protected and one group that is protected shamanically, and then look at outcomes? I suppose you could do that. So you can certainly study it anthropologically without taking a position on the reality of entities, and just talk about different kinds of cultural practices around spirits. And ethically, from a position of ethics, you can look at informed consent. Veteran charities are sending veterans to take part in shamanic rituals to help with their PTSD, with often very little informed preparation or consent to the nature of shamanic rituals that they're going to undergo. So you're having veterans coming from atheist backgrounds who are suddenly on ayahuasca or DMT, immersed in shamanic rituals that they know nothing about, that they can't possibly, culturally relate to or understand. I'm not sure that's ethical.
Yeah, and I'm sure that the situation like that it could produce this kind of existential confusion quite easily, because the beliefs of the shaman and the belief of the participant can be so different on what's going on.
Yeah, exactly. Yeah.
We might have time for maybe one or two questions. Let's see. I'd like to take an anonymous question next. And the way I understand this question is the following. Um, whilst there are now a lot of like psychedelic celebrities and influencers that are turning into guides and trainees in psychedelic therapy, and I think that this kind of celebrity culture, or the attendee thinks that this kind of celebrity culture plays a big part in increase of the use of psychedelics, and it has become quite trendy. But do you also believe that, or do you think that the reason that Westerners are flocking to this kind of these psychedelic experiences is that Westerners are disappointed with the medical care they are receiving within West, and especially in the UK post COVID-19. And also, there's the rhetoric about like fast healing without addiction and harm that might also be playing a part.
Yes, I think celebrity culture is has played a huge role in the psychedelic renaissance. Everyone from Prince Harry to Aaron Rodgers, the quarterback, to Hollywood celebrities like Megan Fox. So generally talking about incredibly positive experiences, they're also sometimes talking about kind of negative experiences as well. But yes, of course. The main way people have got information about psychedelics is through celebrities and through podcasts. And they've tended to be very positive about their experiences because people are much more, if you have a positive experience, you're much more likely to talk about it to anyone who will listen. If you have a really traumatizing negative experience, you don't necessarily want to go and tell everyone about it. You know, you feel wounded and ashamed. So there's a whole positivity bias to how we talk about psychedelics. I completely agree that yes, there's you know there's all kinds of our healthcare systems are overwhelmed at the moment, and as you say, in the UK, there's huge waiting lists, and then sub-adequate care within the NHS, and so to some extent, people are being left to their own devices to try and take care of themselves, particularly for kind of emotional problems. Some of these emotional problems have been exacerbated by the pandemic as well. So yes, and to kind of end on a positive note, many people are helped by psychedelics. Many people have positive experiences. Many people are helped for mental health problems. So there may be a really promising future for psychedelics. And they may help in ways that, because psychedelics affect the kind of the mind, the body, they affect, perhaps they interact with what people call the subconscious. So they may be helpful for certain conditions which are very hard to kind of treat, like autoimmune issues, eating disorders, trauma. So that's the possible upside. And everything, I'm a skeptic, but I need to balance out my skepticism with the potential upside as well. So I don't think it's wrong to be hopeful and to have some optimism about these treatments.
Thank you. I think we might have time for just one more question and a quick answer. Let's try it. Do you agree that psychology, like BSc courses and psychotherapy courses, could be updated to include training with how to work with these psychedelic difficulties or other difficulties emerge from people going to retreats?
100%. We wrote an article for ecstatic integration, looking at 30 different training programs and asking them what do they include on adverse experiences and what do they include on extended difficulties, and writing up whether they answered our email, what there was on their website. So we are trying to encourage training programs to include more about adverse experiences and extended difficulties. Because otherwise it's basically like training people for diving and not mentioning the things that can go wrong, not mentioning the bends, not mentioning how to, take care with your breathing apparatus. And we're also trying to connect with training programs to include modules on this. So I'm working with Clerkenwell Health, for example, their training program to have a module on extended difficulties. I did a webinar with Fluence, who are the biggest trainers of psychedelic therapists, on this topic as well. So I and colleagues in this project and other colleagues not in this project who are also researching difficulties are trying to work with training programs to help make the whole new psychedelic workforce more aware of these kinds of risks, and how to help people if they experience harms, or how to hopefully avoid the harms in the first place.
Yes, thank you very much. I think that's very good to hear. And I really appreciate you being our guest here today. It was great to hear you talk. Do you have any ending words you would like to say to us?
I mean, firstly, that I take a skeptical position, and that's partly because I feel it's necessary at this time. But everything that I say needs to be balanced out with people's positive experiences about psychedelics. I don't want to take away from those positive experiences, from their healing experiences, spiritual experiences, and so on. I'm arguing for a balanced view of psychedelic and other form ecstatic experiences, benefits and harms, to try to take a mature relationship to this domain of human experience. I would love if people subscribe to our newsletter, Ecstatic Integration, and you can find our research at the Challenging Psychedelic Experiences.com website.
Thank you. Next, I will read a few final words of my own, and I also linked to our chat the ecstatic integration that you mentioned. So, if you're not yet a member of Psytu, we invite you to consider becoming one. And you can buy a support membership in our web store at holvi.com/shop/Psytu. And if you're working or studying in an academic discipline relevant to psychedelic research, and currently carry out or are planning to carry out psychedelic research, or wish to actively advance such research, you may apply for a full membership. And you'll find more info and the application form at psytu.fi/n/participate/membership. We also accept donations. More info at psytu.fi/lahjoita. And please follow us on Facebook, Instagram, or Twitter to keep updated about our future events and other activities. And thank you for your time and attention. And goodbye, everyone.
Thank you for having me, Anssi. Thank you, Finnish Psychedelic Research Association.